Welcome to Gold Coast Insider, where we bring you business insights, stories, opportunities, and forecasts from movers and shakers across the Gold Coast. I'm your host, Estelle Rodiguero. I'm CEO of Regional Development Australia Gold Coast. My guest today is Dr. Stephanie Chaousis. Stephanie heads up AI for healthcare not-for-profit intelliHQ as General Manager. She has recently been appointed on the board of directors of the Qld AI Hub and is Chief Customer Officer at Datarwe, a clinical data company developing tools to support secure adoption of AI for healthcare in Australia. Having rich experience at the intersection of public health, technology, research and innovation, Stephanie has extensive knowledge on the current AI and healthcare ecosystem, as well as the practicalities, benefits and risks of AI adoption in health. Stephanie is also a mentor for health tech innovators through Gold Coast Health Tech Accelerator Lumina X and was a finalist in the Gold Coast Women in Business Awards 2023 for innovation, technology and research. Welcome, and it's great to speak to you, Stephanie.
Thanks so much, Estella. It's great to be here.
Now, Stephanie, in my research, you have done some amazing things. And I think when you first left school, you went off in an absolutely different direction in one respect. So when you were at school deciding your career, what was your catalyst for your choice to be a scientist?
Yeah, so I have had quite a variety of different paths in my career, but they do all link together, even though it might not be obvious to most people at first. So when I wanted to be a scientist from a very, very young age, when I found out what a scientist did, I remember, I can still remember to this day learning about photosynthesis, hopefully something we all understand. But as a very young kid in primary school, and I just thought it was so cool. And I thought, oh, how did they figure that out? Like, how did someone know that that's what's going on? Because you can't see that happening. And that's when I learned that, that was scientists. And I thought, I want to do that. I want to find out things that we don't know about yet, that are happening in the world. And so that was always a trajectory for me. I wasn't sure, exactly in what area of science. But then when I got, later into high school and, it's a big ask to choose your career forever at high school. Yeah. So I don't think you need to know. But at the time, marine biology was all the rage. And I do love the ocean, live on the Gold Coast. That's no coincidence. So for me, I picked marine biology, and got in. So then that was, again, it was very hard getting into science subjects. I don't know what it's like now, but back then it was quite difficult. So you just sort of went with what you got, and I got into marine biology and went from there. So yeah, I don't know how far along the journey you want me to go, but that's
all right.
Yeah,
because I sort of thought we'd start at the beginning here because you have an impressive work history. But what was your first jump from university? Because I think it very much appears like whatever you started off with led you to this other field, which was so different, but yet so much the same.
Yeah.
So talk us through that progression. So you first jumped from uni?
Well, so I had some gaps. I did undergrad and then I did more postgrad. And between that, I had jobs in science. So after undergrad, after my honors, I did my honors research project in jellyfish venoms. That's what led me a little bit more towards the molecular biology space, because I learned that jellyfish, box jellyfish, the really venomous one, can kill you within 2 minutes, which is when you understand the biology of how something can sting you on the surface of your skin and get those molecules to your heart in 2 minutes. That's amazing. Like, it's very interesting. It's scary, but it's very, very interesting. And so then it was, there's more stuff we don't know about. What can I learn about this crazy molecular world, which is a universe in itself? So I did research on jellyfish and their molecules in their venom, and then after that, I was a researcher in a lab. So I was then paid to do that work, which is always the dream. After studying, you then get paid to actually do that. And so I worked on jellyfish venoms, and we were looking at, how they affect human cells and potential development of therapeutics, which then started to tie in that medical side for me, because I didn't realize that, we could look at stuff like a venom and turn it into something helpful for humans. And then after that, I worked in drug discovery, so working on other venoms, so spider venoms.
I think you worked in tarantula venom.
Yeah. So look, I wasn't there extracting this venom, I'll tell you that much. It was already someone else did that. I just got it in a tube. So it sounds a bit more hardcore than it was. But again, it was looking at the molecules and what they do and how they can be used. So loved that. But did miss the ocean a bit, missed getting out on boats and things, which I did an undergrad in marine bio. So I went back to do my PhD then after that. Still in molecular, but also doing environmental science. So my research was on sea turtles. That was by no mistake, because I know sea turtles live in warm tropical waters, and that I would be able to go and see these turtles there and do that as part of my research. But then tying in my molecular skills to actually develop a novel project. So I borrowed biomarker discovery techniques from medicine and applied it to wildlife for the first time, which was very cool to do something that was quite new. So I was looking at their blood and seeing if they were having any negative impacts from contaminants in the water. While I was doing this project, I was learning about all these new machines we have that can actually tell you exactly what a protein is in your blood, which is crazy because, we can't see proteins with the naked eye. So it's very complex to actually be able to figure out what one of the thousands of proteins that are in your blood are and how many are there. So we have all these amazing machines that can do this now that have been developed in the last, 20 years or so. But then what you end up with after you've done all this analysis is a huge pile of data. So while you've, been able to, so I would go out on the boat, extract the blood from the turtles and run it through these machines, just to put it simply. It was a lot of work between that, but just to put it simply. And I also was maybe a bit naive and thought, great, I'm going to get the answers once I've, run these results. And then I had just all this data that I needed to make sense of. And, this was sort of 2015 when the conversation around big data was really coming up of, we've reached this point where we can find, gather all this information. But it's like, for the average person, you go on Google and, Google fortunately has a lot of tools that help you make sense of it, recommendations. But if you were to just have all the internet from the data, all the data from the internet, to make sense of it is a huge amount of work. And I then started learning about how AI can help us do this. When we've got multiple complex data sets, how do we make sense of it with the tools we have currently? We often can't to the level that we could if we had AI.
Yeah.
And that fascinated me because that tied back into, I've got all this data in front of me. I've got this Excel spreadsheet with millions of rows of data. There's information in there that we don't know yet. And I'm really excited to find out what it is. How do I do that? So the first point was becoming a scientist. And now it's like, well, what tools do we need to do that? So that really excited me. So then I, was finishing up my research, but I knew that academia wasn't for me. Probably because I love to talk to people too much. And, in academia, you're often, you sort of do a lot of stuff on your own. I mean, you do collaborate, but a lot of the time you're deep in your research and your niche. And I love talking about cool stuff like, like molecules and sea turtles and AI and also talking about it in a way that other people can understand it and that I can talk about it more with them. So really just a big nerd ultimately, but that wants to talk a lot. So that's not great for academia. So then I was just sort of figuring out what I wanted to do. And I heard about this new precinct that was opening across from my uni. And I was really excited because up until that point, I knew I thought I had to leave the Gold Coast to do something really cool. I thought, mainly the jobs here are in tourism and, there just isn't big tech here or cool tech jobs. So I was even looking at going to the US, to be honest. Fortunately, I didn't because that was right before COVID. But, I heard about this new precinct opening and they were running networking events and talks. So I would just come along because I was really excited by it. And I saw someone talk one day about how AI can be used to make sense of multiple data sets. This was applied to the medical field, not in biology, but there's a lot of crossover in those things. I think people don't always realize it's very similar. So I understood a lot of what he was talking about and was very excited. So afterwards I just said, oh, this is so interesting. I, to be honest, wasn't really looking necessarily for a job from that conversation. I was just really interested about it. And that was Kelvin Ross, who is the founder of Datarwe. And we just had a conversation. And look, the Datarwe didn't exist yet as a company. So that pause that story there. We had a great chat. He said, oh, happy to like chat with you more about this and the work we're doing. So got, email addresses, stayed in touch, but then I did go on to do other work after graduating. So it's probably a longer story than you were anticipating. But it went on, and then was working in environmental science in for council. So yeah, that was also driving boats around, which was cool. But right at the start of lockdown, I got a message from Kelvin, who hadn't spoken to for months, and he said, "Oh, we've just gotten funding. Do you want to come work for me?" And I was like, "Absolutely," because all my teammates at council were probably sick of me talking about AI every day. So I was like, oh yeah, I think I need to go do this.
Yeah. Into our next question. You are the Chief Customer Officer for Datarwe, but do you want to talk us through what is Datarwe? Let's get an understanding.
Yeah, absolutely. So Datarwe is really a data science company, but we do quite complex data, what's called data munging. So I guess sometimes we refer to ourselves as like the plumbers of data, which doesn't sound very glamorous, but really, once we start talking about AI, it's important that people understand that data underpins it, because AI can only perform actions or learn as well as the quality of the data that it has to learn from. And so there are many, many things that need to be done to data before you can actually use it. A very simple example, maybe, we all know if we want to look at exchange rates or temperatures across different countries, those will be different. And if you were to give AI a bunch of temperatures from around the world and you didn't tell it that there was Celsius and Fahrenheit, you would get some very weird results out of a predictive question you might ask it. So you need humans to do a lot of the cleansing and labeling so that AI understands what the data really means about the real world. And that's what we do at Datarwe. We have we have a great team of people who are amazing data scientists and engineers who do that in a very complex way. I'm not going to do them justice the way I'm talking about it, but that's probably the simplest way to explain it.
Right. So your role, okay, so what is that data about? I mean, so you get that data and then you work with the AI, or you put the data into the AI. Is that what Datarwe does?
So
health or?
Yeah, health. So we're health focused. I didn't mention that before, but that's probably key. I'm so seeped in it, I just assume.
No, you're right.
So I think sometimes it's easy to talk about it with an example. So if we say, we want to predict, whether someone is likely to have a negative outcome from a medication.
Right.
That's obviously helpful if we can predict that beforehand. So the way you do that is you need to take a whole bunch of data from previous examples where people may have had a negative result and then look backwards. So you're almost like FBI going, what were the clues that we didn't see that this person was going to have a negative reaction, and is there a pattern there? But again, that's too difficult for a human to do. We need AI to do that. So we need to again, put the data into a sort of format and label so that AI can do its investigative research, I guess, and figure out what the clues were, what kind of things need to be flagged to predict if someone is going to go into, have a negative outcome. Now, what kind of data might that be? Well, it's not just going to be, here's person A, this is their name, and this is what happened. That doesn't tell you anything. In order to include all of the clues, you need to have as much data as possible. So what was their body temperature? What other medications were they on? How old were they? What was their genetic background? Had they traveled somewhere recently? A whole bunch of different things that aren't recorded in one place, that need to come together to look at these clues of what might have led to this bad outcome for this person. And then you take that and you want to look at 1 million people. So you have some really statistically robust results. And that's, as you can imagine, an enormous data set. So at Datarwe, we're doing that with different hospital data sets. So we currently have 16 hospital ICU data sets on board. And if somebody wanted to research, a particular ailment that would be seen in all of those hospitals, and wanted to connect all the data from each hospital representing those medical episodes, it would take them a long time because they'd have to go to each hospital, request the data. Someone would have to dig out those data points, make sure it was clean and make sure it was accurate. We've done that already for all of the data. So now a researcher or the hospital themselves can come along and say, oh, we want to know about all of X, Y, and Z. And we can help them pull that out. And it's a much faster and efficient way for them to access data.
Yeah.
Yeah.
Excellent. So that then leads me to you are also the general manager for intelliHQ. What is intelliHQ?
Yeah, great question.
Starting point for that
I get asked this a lot. So intelliHQ was founded in 2017 and it's a not-for-profit. And it was founded with the goal of supporting innovation of AI in healthcare. Because, healthcare, especially hospitals, their primary purpose is to care for patients. It's not to, do all this tech innovation. So the resources aren't necessarily there or the priority's not there. Completely understandable. I think it's a good thing. And there was an awareness that there needed to be a separate entity to support that innovation outside of the actual healthcare system. So it was set up as an avenue for there to be awareness, education, incubation support, especially for clinicians who had maybe heard about AI and were like, well, I see this with my patients every day. I have a sense that if we could predict this, we could have better outcomes. And so they could come to intelliHQ and still can, and they can say, I've got these ideas, how would I go about, executing this or researching it. And then intelliHQ can connect them with data scientists, with the data sets from companies like Datarwe, with the hospitals they might want to speak to. So really an accelerator of innovation. Now, as time went on, we realized that one of the barriers was that there was the education piece. Not enough people understood AI and the potential of it to be motivated to innovate. And we do know from experience, and I don't mean we, intelliHQ, I mean globally, we've seen this over history that we need clinician-led innovations for healthcare. They cannot be led by technologists. There needs to be clinical input because it's a very specialist area, and there's things that a technologist might think would be amazing, but a clinician will know why they will or will not work. So we more clinicians leading these innovations, whether they build them themselves or not, just leading the idea. And so we then were awarded a tender by MTP Connect, who is the medtech pharma industry supporter from the federal government, to run a national AI in healthcare training program. So that's really become largely what we've done over the last few years. So in that program is very successful. We partnered with MIT and we ran a course for over 200 people. We had a really great completion success rate. And then we ran a datathon, which was where these clinicians who are really interested in building these things could actually try and build something, predictive, over a weekend in a team with data scientists and data and all of that. So it's a very, very fun thing. People have probably seen hackathons. It's kind of like that, but centered around data and health.
So what would be an example of that?
Yeah. So an interesting example, I mean, there's so many. We've had about 30 or so different projects stand up from that. But one was, when people are in the hospital, they're often getting very regular blood tests because the doctors need to know what's going on. Are they getting better? Are they getting worse? Is the medication working? But, oftentimes, a patient might not need the last 3 blood tests they get, they probably didn't need. But it was important for the doctors to do them, and that's the routine care. But these clinicians had the idea of, well, what if we could predict when would be the best time to stop taking blood? And there's many reasons to do that. Obviously it's expensive to do that. It's, you're taking vital fluids from someone, all of that. No one likes needles. So they were building a predictive tool that could look at, well, when do we need to take a blood test and when don't we? Another one was looking at prediction of antimicrobial resistance. So that's a very interesting one for anyone that knows about the space, is that if you, and I don't want to scare anyone, we've got lots of great medications, but if you were exposed to enough bacteria that we don't have any antibiotics for, and the bacteria are resistant to all treatment, it's quite bad because there's not really anything that can be done. But if we can know more about why that happens, we can really prevent that. And so they were looking at pulling in data from, people's travel history, because that's a big predictor of what bugs they've been exposed to, as well as, past examples of where resistance has turned up, and creating a live dashboard so that, doctors, as they're treating, could see coming up on this dashboard, oh, this is, there's new resistance coming up to this drug here. Let's use this drug instead. And making a lot more real-time tools for clinicians to treat people better, which is probably one of the main things Datarwe helps do, is really that real-time information. Yeah.
Wow. So is this available to all doctors now, or is it
So do you mean the courses or the
intelliHQ, that information for doctors? And from a layman point of view, I go to my doctor, I say I've got X, Y, and Z, and he
Right.
actually literally, particularly when you travel, you come back with some really missing things. Can he actually access that information or not?
Yeah, so no, and this is exactly the problem that Datarwe is trying to solve. And the reason they can't, I mean, there's good reasons. There's a lot of data privacy. So, no one, even in an official position, can just access different data sets about you without your consent. That's great. But we're looking at discussions on how can you share data in a safe way when we know it can significantly positively impact people. And that's what Datarwe is helping doing, because we're putting data in the cloud. And when something's in the cloud, so basically it doesn't need to be stored on a computer, it means that, someone only with the authorized login can access that information about you when it's required. And then that access can be removed, and so that makes it a lot safer. It's not like they're downloading and keeping information. And again, that was a great question to sort of answer a bit more complexly what Datarwe is helping do. So yeah, unfortunately, those kinds of technologies aren't widespread yet in Australia, and there's many reasons for that. But this is where we're trying with intelliHQ and Datarwe to raise that awareness, get these clinicians on board to innovate, come up with these ideas, and then help develop them, which really requires a lot of collaboration. But it would be amazing to see this kind of technology at the fingertips of our clinicians. It would really, really help.
So then we've got Datarwe, and they do the data, and they sort out the data. This is layman. This is really bad. Sorry.
Oh, good. Yeah.
And then you've got intelliHQ. How do they complement each other? How does that work? So intelliHQ is using the data that Datarwe can glean.
So, actually, first of all, just for anyone who's in the data space listening, so Datarwe doesn't have any right to share data. The data is only shared when the custodian agrees to it. Because not everyone will know that, but yeah, that is an important point. So Datarwe provides a service to hospitals, and then the hospital still ultimately says yes, you can share this data. So intelliHQ was founded to help spin out commercial companies for AI in healthcare, and Datarwe was the first of those companies. So the main way that I guess they're complementary is that we will have clinicians come into intelliHQ and learn about the kinds of things that they could build and develop. And then when they want data access, we can let them know. Datarwe, like other vendors, so it's not just Datarwe, but those are the two companies I'm personally across, but we can connect them with any sort of vendor or technology support that would help them build what they want to build. So Datarwe is one of those who can help with specific types of data. And then, Datarwe takes the lead from there and helps the clinician connect in with, okay, what governance, what approvals do we need? How do we get that access? And how do we have the advanced, data science, AI input to build this cool tool that I want to build?
So you lightly mentioned AI and privacy around information. And there's been a lot of information about AI, a lot of scares out there about AI and how it's what it has the potential to wreck our lives. How do you ensure? So I'm taking it that from Datarwe, it's patient information, and we can give access to that, but not necessarily do you have to notate our names. Is that something?
Yeah, absolutely.
If I'm in hospital and I've got something, I've came back with something, and do I get asked if I'd like to share that information? Is that how it looks?
So I'll give an example that helps people get their head around this. When COVID was happening, most of us were watching the statistics. COVID, that there's 10 cases here, or this is how many people have been vaccinated in this area. That was all of our data. Those were people. When it was saying, 60,000, 60% of people vaccinated in Victoria. Those were individual data points, but you didn't know who that were. And that's because that data was de-identified. So the data can be separated from who you are. It's still important information. If you were to say, there's 50% women, 50% men, that's information that's about individuals, but we don't know who those individuals are. You can get a lot of really important, interesting information about, health without needing any identifiable information. So it's the collective information. It's not individual information that's being used. That's really key.
That's good.
And it happens all the time. So it's not a AI is taking your name and your address. That absolutely is very, very strict laws in Australia about that. It does not happen. Datarwe only works with de-identified data, so nobody can see who someone is, where they're from. It's really an aggregate of, here are 50,000 data sets of patients who had heart attacks, but there's no information about who they were or anything, only the clinical data. And so, Datarwe has to go through a lot of steps and checks by external parties to make sure they're meeting those regulations of, you've removed this and that. So to assure people that, Australia is fantastic with their laws around that. And so, no organization can be doing anything with your personal data that you've not consented to. And that certainly doesn't happen in our space.
Oh, that's excellent. That's excellent today, particularly given all the data leaks that have happened recently. So if somebody get asked, I'll definitely, if I ever get asked again, I'll definitely go ahead with it. But what's exciting about AI, I guess, is how it can provide us with accurate predictions using those insights. But you've also, Datarwe have also built PMDP, which is Precision Medicine Data Platform, correct?
Yep. So I love this term precision medicine, and it all ties together, data, precision medicine, and AI. So when we say precision medicine, I mean, that's really the pinnacle of healthcare treatment, is if we could treat people, as they needed specifically. So now I will try and not nerd out too much with my biology, but as we know, usually treatments are developed that are just general for a disease. So, COVID vaccine is a great one. I know it can be contentious, but it's very easy to talk about because we all know about it. So there was just one vaccine developed to fight the virus. There wasn't a different vaccine developed for different people. But as we know, we're all genetically uniquely different. And that means that we will respond differently. The same way I might be able to eat a strawberry, person next to me might have an anaphylactic shock and die. Doesn't mean the strawberry was bad. It just means that I had a different response, or someone else had a different response. And so it's very, very difficult to develop precision medicine. It's just the reason that, pharma doesn't produce one medication for this type of person. We just don't know how to do that because it's so complex. But if we could, that would be amazing, because we would have not seen anybody have negative effects from the vaccine. We would have not seen anybody have negative effects from other medications, because we would know, okay, this person needs this kind of treatment, this person needs this. But again, it's something, it would be the pinnacle of healthcare. It's incredibly difficult, but big data and AI can help us move towards that. And so that's why the precision medicine data platform is called that. It can help. So again, it's all about the data, but I know that can sound very dry and boring, but there's a lot of data. If you have enough data, you will start to see patterns. So even though we are all unique, we will fall into groups. So you will have people who will respond the same as you would, And then we can create in this data platform what we call a digital twin. So I guess an anonymous, digital physical being that responds to things the way you do, but we can predict that because we have this digital being already that we can digitally check, oh, how would this person respond to this medication before we give it to you? And that's the goal. I'm not saying we're there yet, so I don't want people to get, ahead of themselves, but if we could do that, it would be amazing, because then you wouldn't need to go through what a lot of people go through in healthcare, which is they try a medication or a treatment, it doesn't work, try another one. We could predict this. And so people would be treated based on them, their physiology, their background, their genetics. Yeah, so that's what the ultimate goal and dream is, and big data and AI can definitely help us get closer to that.
Wow, that's predictive medicine is really good. I mean, the amount of times I've had antibiotics to go, now, are you allergic to this one? Have you tried this one? I have no idea, but
I mean, that's it.
yeah.
I mean, look, and there's also a lot of stuff that AI, as we've seen with like ChatGPT, generative AI, is taking out the mundane stuff. You don't have to fill out a form 10 times, or you have to answer the same question. I think that's where we're going to start to see a lot of AI around us, and then it frees up your time and your mental space to, do other things. And I think that's one of the best things at the moment that we're getting from AI.
So, Stephanie, does that also mean then, and this is just thinking off the top of my head, does that also mean that you'd have to have good records, wouldn't you? As a patient, I would have to have really good records kept in order for that to happen. I mean, for me to go to the doctor with something wrong with me, I might go to any doctor, but those records are the vital part. And I think we have a say in whether the records are kept electronically or not. And a lot of us are scared and saying, oh, no, that's just too much personal information to be kept electronically.
Yes.
So how do we overcome that? I mean, how does that work?
So I think, how do we overcome those fears?
Yeah. Those feels, because that's where our name and our details are.
Yeah.
Right?
Yes. So I think what we find interesting is that the reaction of people to their data being held digitally and used for things in healthcare is very different to how they're probably using it every day. They give their phone provider, Facebook, all of their social media, LinkedIn, banking. In every other industry, we gladly hand over our data, and why is usually what I ask people. Why? Why did you give Facebook your information? There was a payoff. Oh, well, I could join the social network and talk to people, and I love that, and I don't want to miss out. Don't you want the best healthcare? It's the same thing. And look, to be honest, I understand, and I'm not saying that things don't happen and there's not it's not warranted to be concerned. You should always be discerning about where you share your data. But if anything, healthcare is the last place, because healthcare is full of people who want to help people. People become doctors because they want to treat people, they want to do the best job they can. It's a very safe and important space to share your data so you can gain the benefits from sharing it. So look, I with those kinds of fears, it's hard to just dispel it. I'm not going to be able to single-handedly, convince people. I just encourage people to look into what are the benefits of sharing your data and having it, and also understanding, the de-identification process. Most research and innovation will not happen with your name or anything about you. It's just, benign data points that don't identify you at all.
Yeah.
So it is very safe.
And you had me at we give all our information.
Yeah. People post, they're posting their
intimately, I think.
Yeah. I mean, you know what? Even actually is very interesting that people often don't realize is things like flybys and Woolworths and that. They know a lot more about you than they think. There's a classic story of a girl got sent this is more back when people get sent catalogs, and this catalog was like targeting women who were pregnant, and they knew she was pregnant before she'd like told anyone, or because they're looking at the patterns of things you're buying. So we're sharing our data all the time, and I think that that's okay. I think that there's we see the benefits a lot more than the risks. There's always risks with everything, 100%, but we've just realized that there's a lot of safety in place, especially in Australia. So
So you've also just recently joined the board of Queensland AI Hub as director.
Yes.
Wow. And can you tell us a little bit about what that does and what that role is?
Yeah, for sure. So, at the AI Hub, we are really looking at how we can serve the community, including SMEs and, partnering with big tech to help, Queenslanders, adopt AI or at the very least understand it because, knowledge is power. And when you understand something, you're less fearful. It doesn't mean you have to embrace it if you don't want to, but if you understand it, you can feel a bit more comfortable with it being around. And so the AI Hub has done a great job of doing this. Last year, they ran the AI Summit. They booked out 600 people within a matter of weeks, which just showed the appetite of the public to learn more. And so, being on the board, it's really looking at, where can we take this? How can we support the community? What are the avenues we can take to help people, A, understand AI better, and B, for businesses in Queensland to start using AI. And look, again, when we talk about AI, it's such a broad term. It doesn't mean we're having robots who are humanoid, greeting your customers. It's like, can you make some of your tasks easier? Can you make more money, by using just automation, by using some smart predictive technologies, and that are specific to your business? And how can we at the AI Hub help you do that? So I was very honored to be asked to do that role. And it's been great so far. The team's already done an amazing job. So it's just really great to look at where can we move from
I
here.
think AI, obviously, it is now, but it's also the future, and it's something that we all have to adopt, and we all have to learn how will it benefit our lives, and whether that's a business life or a personal life, we need to look at the best adoption for ourselves into to AI and work with it and be on the front foot with it.
Yeah.
So I think that,
Yeah. And
that's amazing.
another comparison I like to draw, which, it's not exactly the same, but I remember Y2K. I'm old enough to remember that. And, the internet really becoming mainstream. And obviously, there were a lot of fears. Well, what can happen with this internet? You can suddenly, people can contact you from anywhere and all that kind of thing. And yes, having the internet facilitates for some bad things when there's bad people who want to do that, but it facilitates a lot of amazing things. And the same with any technology, it's just a reality. And I think that's a challenge is that we all need to understand that with every innovation we've had, another one that I use in medicine is a knife. A knife can be used to murder someone or can be used by a surgeon to cure someone. And so it's more about how it's used. And yes, there will be new things that come up, but we do know that having the ability to develop policing AI, so having AI to fight AI, is a benefit as well. So it's the same thing we've seen with the internet. We've seen new security practices come year on year as it evolved. We've seen new technologies come to make it more secure. Now we all have multi-factor authentication, all this stuff. And we just see the same with AI. It's going to be the same thing. I don't believe there needs to be this enormous fear. And we are further from general AI, which is an AI that can do what a human can do. It's not specific to a task. Then I think we sometimes see in the media. So I would encourage people to know more, embrace it, and then you can be part of it and learn how to benefit from it.
So what do you see as the future within the healthcare sector in reference to your speciality, like, what you've explained here today?
Yeah, so there's actually this great book by a man called Eric Topol. So he's a physician in the US, and he wrote this book called Deep Medicine. And I love the way he describes the future of medicine with AI. And he says, it's that a lot of the tasks that now our clinicians and administrative people in our hospitals and healthcare are burdened with will be done automatically, quietly, whirring in the background. And you'll walk into a hospital and they can greet you calmly because they're not doing 10 other tasks. Your clinician can look you in the eye and not be typing on a computer. So he actually imagines the future of healthcare being a very becoming more human centric, and the clinicians being able to spend more quality time with their patients and more face-to-face time and provide more personalized attention. And I think because that speaks to the automation of the mundane tasks rather than a futuristic, everything's machines, I think that's more realistic. And I really love that idea. And I do hope that that's what we're moving towards. And I do think it's possible. We are seeing, uptake of automation for those kinds of things and freeing up people. So when you walk in, you're greeted by someone who's not just staring at a computer. And I think that's actually a really unique take on what we'll see. But I do see that for us, and that's what I hope.
Oh, that would be the perfect world, wouldn't it?
Yeah.
So what is it about the Gold Coast that makes it the right place for innovation? Like we're amazing. I think we punch way above our weight in innovation here on the Gold Coast, and particularly within that medicine, the medical, the AI, the everything to do with the healthcare sector. What do you think it is about the Gold Coast that makes it the right place?
So I think all of the amazing work that's been done over the last 20 years to really build up an ecosystem that allows for this kind of innovation. So obviously the precinct, we're based, we're right next to the university, to the hospital. There's now other buildings going up. I can see them, which is great. We've been waiting for years. And that means that the physical proximity is great. So you've got these precincts that are being fostered by the government to support that innovation and collaboration. I think the Gold Coast has so much potential because there's less competition currently in the space. So, for example, if you go to Silicon Valley, it's like every second person is in a startup or innovating and developing. Because there's less competition, there's a bit more breathing room for people to innovate, and the amazing talent we have here to get into a role like I have and really bring their creative input, and not be sort of, between these walls of competition because it's happening everywhere. I think there's just so much potential here. There's many great companies that we're now seeing pop up that are complementary. And again, with Datarwe, we basically say we don't feel anyone. We want to collaborate because there's such a big pie to be made already, to be made yet. It's not even about taking a slice. It's like when we collaborate, we make a bigger pie because there's so much potential. So Gold Coast, for those reasons, because of the investment we're now seeing in creating an amazing tech place. But also, the lifestyle, like how great is it to be able to live somewhere like the Gold Coast and then go and do a really cool, tech job and work in the tech world. I'm really grateful, and it's a great place to live and work. So, that's my view.
I was going to let you off the hook, but I'm going to keep going because I want to know also, what do you see as what would be the catalyst? What's required to grow the sector? I think the sector's grown exponentially in the last few years, definitely since COVID for sure. And exactly what you say as well, there's a lot of coordination, there's a lot of cooperation within the whole medical field. But what do you now need to grow the sector? What does the Gold Coast need?
Yeah, so we as a precinct participated in Queensland Connects last year, which was about looking at what does your city need to grow this specific area. So we've actually analysed this, so I can give the answer we came up with. But to be honest, it was investment was a big part of it because we have so much talent here, so many great ideas. Lumina X, which is the health tech accelerator that comes out of Cohort, and they do an amazing job. They are having tens of applications of people who founded startups. They've created, a technology in health and wellness. And, but you just need that initial investment so they can get off the ground and really build some great things. That investment can come from many places. So I don't really particularly have a view on where it should come from. But if we had that injection of investment, we would absolutely see things grow because all of the foundations are here. We have the innovations, we have the programs to support those companies coming up, especially, how amazing to have the next Canva or the next, Google come from Queensland, come from Gold Coast. But that does take some investment. It takes some belief and investment in those companies. Really, I think that other than that, there's the talent, there's the space, there's the willingness. It's just having that score. Yeah.
So the last question, I promise this will be the last one. In relation to Datarwe and intelliHQ, what are the skills or the skills or the training or the jobs that are required for the future? So if I'm someone at university or someone at high school this year and I'm thinking, this sounds really exciting. What do you need moving forward in the future? What can you see?
Yeah. So there's two things. One, I always say is adaptability. So, the reason I've had such an amazing career so far is that I was very open to opportunities. And when they came up, I was ready to take them because I was open to them. I wasn't sort of niching myself into one area. That's fine if you want to do that. But if you want to have, learn different things, then being open to opportunities that will put you in the space to learn those new skills is key. And so you need to be adaptable, and it can be scary, but I think just being ready to try something new. I personally think that STEM, I'm not saying everybody needs to do STEM, but doing STEM, so science, technology, engineering, are amazing foundational degrees, not because you need to become a scientist or know physics or anything, but they teach you how to find accurate information. And that's going to be a big challenge moving forward as we have generative AI and we start to lose sight of what's real, what's, is this genuine? Because it'll become easier and easier for people to fake things, as we know. And not only that, but just also in general, being in an information flooded world, having that skill set, I really see how that's helped me. And that's really the training you get when you do a STEM degree. No one's told me to say this. I'm not, no unis are sponsoring me. It's just genuinely, I think that even an undergrad in STEM has been so useful. And again, it doesn't mean you need to go and be a scientist or an engineer or anything. It's this baseline skill set that will help immensely. So those are the two things I would say. But also, just being brave. I mean, even if you don't have any qualifications in something, going and putting yourself out there. I mean, if I'd applied for a job that I got with Datarwe, I don't think I would have gotten it on paper, but I went to the networking event, I spoke to people, and that's what helped me get connected into a really cool space.
Very good. Oh, thank you so much. So you started off your career on a boat sitting out at Moore Island chasing turtles?
Yes. Yeah.
And at least you haven't moved far from the ocean. I'm guessing the ocean is very close to your heart.
It is. Absolutely. Absolutely. I need to get out a bit more again onto those boats.
Yeah, we do. Look, it's a pleasure to talk to you today, and thank you for all that information. You're amazing, and I hope we can catch up again in probably about 6 months' time, and let's see what is happening within the world, because it moves rapidly, doesn't it? Like the changes are fast.
Absolutely. Absolutely. Thank you so much for having me. It was great to chat.
Thank you.
Thank you.
Thanks for listening today. For a complete list of podcast episodes and transcripts, go to rdagoldcoast.org.au/podcasts. And don't forget to follow us on Facebook, LinkedIn, or Twitter.